Hello, my dear students. I'm Dr. Vaishali Bharambe. I've been teaching anatomy for more than 25 years and I love it. Today, we are starting the study of tibia part 1. Why part 1? Because I'll be covering only the upper end of tibia, okay? And then the second part of it will be the shaft and the lower end, okay? So, I'm requesting you to sit for this lecture with a bone in your hand. Don't just sit without the tibia. Because without the tibia, there are so many features of tibia that you will not get to see. You don't have to have a real bone like I do. You can have maybe an artificial bone, but sit with tibia. Sit with the other side tibia also to help you side identify. Maybe you can have a femur with you for articulation. Okay? So, what are we going to do today? We're going to cover the bone, its side identification, normal anatomical position, and the upper end. In tibia part 2, I will be covering the shaft, lower end, ossification and a number of applied aspects. So I hope to see you in both my videos. Okay. So let's begin tibia part 1 with the question, what and where is tibia? So this is tibia. Okay. The medial bone of your leg. Laterally, you can see here's the fibula. So just orient yourself, tibia medially, fibula laterally. It's also called as the shin bone. What functions does it perform? So I'm sure looking at the bone you can guess at some of the functions, like it's a weight bearing bone. It's important in movement. You can't possibly walk without your tibia. It's important in formation of knee joint as well as ankle joint. It forms a protective hard cover for some very important blood vessels lying posteriorly, and it's an important site for attachment of muscles. So these are basic functions of most bones, but they are especially important where tibia is concerned. What is joints formed by tibia? Knee joint, ankle joint, and the tibiofibular joints. Superior, interosseous and inferior tibiofibular, joints between tibia and the fibula. So let's introduce the tibia bone to ourselves as a long bone which has an upper end. This is tibia, this is fibula. It has an upper end, a lower end and a shaft. Today we will be focusing on the upper end. But before that, I want to introduce the bone to you so that you can hold the bone correctly during this teaching learning process. So we're going to side identify and we're going to do normal anatomical position. For that, I'm going to show you how to hold the bone with just few basic identification points, how to hold the bone correctly and identify the site to which it belongs. So let's begin. Remember, the condyles go superiorly, the narrow end goes inferiorly, malleolus is medially, interosseous border is laterally, tibial tuberosity anteriorly and soleal line posteriorly. So is there any point in explaining this here on the screen? No. So, come, I'm going to demonstrate this to you. So, the condylar end of tibia must come superiorly. The narrow end, see this is wide, this is narrow. The narrow end comes inferiorly. The malleolus, can you see this malleolus? The malleolus must come medially and the interosseous border, you will be able to feel the interosseous border if you run your hand on it. The interosseous border should be laterally. The tibial tuberosity felt here should be anteriorly, and if you turn the bone around, this oblique soleal line should be posteriorly. If you have all these in position, then the medial malleolus will point to the direction opposite to that of the bone. Now this medial malleolus is pointing to my left. Therefore, this has to be my right side tibia. Okay. So what have we completed? We've introduced the tibia to ourselves, we've talked about its functions, some basic features, side identification, normal anatomical position. It's quite a journey for such a short time. Good, we're doing good. Now my suggestion to you is hold the tibia in its normal anatomical position and do not move it. Don't turn it around too much, okay? Otherwise you will lose orientation. So, tibia features. Let's talk about the upper end. The upper end of tibia has two condyles, medial condyle and intercondylar area, lateral condyle. And it has a tuberosity. So this is what we are going to learn now. We're going to focus on the upper end. So now, activity again. This is the medial condyle, this is the lateral condyle, this is the intercondylar area, and this is the tibial tuberosity. The 4 areas we are going to study today. Take a look at it. This is the medial condyle, this is the lateral condyle. This region in between is the intercondylar area, and this is the tibial tuberosity. Medial condyle, lateral condyle, intercondylar area, and the tibial tuberosity. Come, let's learn about this a little more. So we are now looking at the upper end of tibia. This is the medial condyle. Okay. So as you can see, from the medial condyle descending down till the tibial tuberosity is the medial patellar retinaculum. Medial patellar retinaculum is a part of the capsule, and it's actually an extension of the vastus medialis muscle, participates in formation of the capsule of knee joint. Just below it you will see the attachment of the muscle semimembranosus, and below that the attachment of tibial collateral ligament. Turn the bone over, you will continue to see the semimembranosus continuing its attachment along the medial condyle. Okay, so I'm going to show you this now. Remember, if you see carefully, this is the medial condyle. This you will find there is a little groove here where the semimembranosus muscle gets attached, and just below that you will find the tibial collateral ligament. Okay. Now we're talking about the lateral condyle. Now look at the lateral condyle on the bone with you. This is the lateral condyle. Just like the medial condyle, there is a lateral patellar retinaculum descending down to the tibial tuberosity. This is again a part of the capsule of knee joint. Below it you will find an oval facet for attachment of the iliotibial tract. I want you to look for this on the bone that you have in your hand. Okay. For example, now I have a bone in my hand, and just below over here I can see a flat facet. My finger is literally going and attaching itself there easily. This flat facet is for the attachment of the iliotibial tract. Now let's ask ourselves, what is iliotibial tract? Iliotibial tract is the downward extension of fascia lata. It's a thickening of fascia lata. The gluteus maximus gets attached to the iliotibial tract, and through it exerts its pull on the knee joint, acting as an extensor or extensor of the knee joint. Turn the bone over. We are now looking at the tibia from posteriorly. This is the lateral condyle, and this is the attachment at the very edge of the articular surface, the attachment of the capsule. Now I want to bring your attention to this muscle popliteus attached on the posterior surface of tibia, and this tendon of popliteus, which is intracapsular, which escapes from the knee joint by passing in this gap between the capsule. Okay, so this gap that we drew in the capsule was for the passage of popliteus tendon. Below and lateral to it, you will find an oval facet for articulation with the fibula. Take a look. So this is the lateral condyle here, and below it over here you will find a nice clearly visible oval facet. I hope you can see that. It is here that the fibula comes and articulates, forming the superior tibiofibular joint. So now I have some questions for you. What is iliotibial tract? What are lateral and medial patellar retinacular? Explore the intracapsular tendon of popliteus in the knee joint. Now these are all questions which I have briefly answered a few. I want you to explore this. The answers are of course given at the end of the lecture in the form of notes. Okay, but try and explore these on your own and learn something more about this tibia. Now turn the bone over. We're going to look at tibia from the top. We're going to look at the upper surface or the condylar surface and the intercondylar area of tibia. So basically, I am looking at tibia like this. Okay, you're looking at this surface. Remember, this is medial, this is lateral. Therefore, this is medial condyle, this is lateral condyle, and this area in between is the intercondylar area. Okay, this is medial condyle, this is lateral condyle, this area in between is the intercondylar area. For orientation, remember, this is your tibial tuberosity, right? Come. Now we're looking at the superior surface of the condylar surface of tibia. This surface is covered by hyaline cartilage. This is the medial condyle, this is the lateral condyle, and this is the tibial tuberosity. Orient yourself. You see that the medial condylar surface is ovoid. The lateral condylar surface is almost round. The medial condylar surface is covered by a C-shaped medial meniscus, and the lateral condylar surface is covered by an almost circular lateral meniscus. So medial meniscus here and the lateral meniscus here. Medial meniscus is larger, lateral meniscus is smaller. So always try this. Okay, if we've been doing this since our college years, I'm sure you know how to do it. A larger C is your medial meniscus. A smaller C, almost circular, is your lateral meniscus. And the area inside here is the bony articular surface covered by hyaline cartilage, which articulates with the femoral condyles. This area now in between is called as the intercondylar area between the two condyles. Okay, so again question, what are menisci? What is their function? What type of tissue are they made up of? How does the presence of menisci help the knee joint? Please explore, and of course the answers are already given in the notes section. So let's talk about the intercondylar area. Here I want to give you a mnemonic. The Medical College London, London Medical College. I don't know why you need a mnemonic, but even we as students needed this mnemonic. So use it if it feels useful. T stands for this transverse ligament that connects the anterior end of the two menisci. The M stands for anterior horn of medial meniscus. The C stands for anterior cruciate ligament. The L stands for anterior horn of lateral meniscus. So transverse ligament, anterior horn of medial, anterior cruciate, anterior horn of lateral. Now posteriorly, what do you see? Posterior horn of lateral meniscus, posterior horn of medial meniscus, and posterior cruciate ligament. These are the structures you will find in the intercondylar area. You will also find two bony prominences that fit in between the two tibial condyles. So this is the intercondylar area. Let's now come down and forwards towards our tibial tuberosity. If you look at the tibial tuberosity carefully, okay, you will find that it has the upper smooth area, it has a lower rough area, and it has an area above the upper smooth area. If you look at this bone clearly, this is the upper smooth area, this is the lower rough area, and this is the area above the upper smooth area. Okay, so come, how does it matter? Let's understand. The upper smooth area gives attachment to ligamentum patellae. What is ligamentum patellae? It's the tendon of the quadricep muscle which has got inserted into patella, and from patella the tendon enters and gets attached to the tibia at the upper smooth area. Below that, the area below the upper smooth area or the lower rough area is related to subcutaneous infrapatellar bursa. Area above this is related to deep infrapatellar bursa. I'm going to show you a diagram to help you understand this better. This is femur, this is tibia, this is fibula, and this is the patella. This is the tendon of quadricep or the muscle of quadricep which is attaching into the patella. As you know, patella is a sesamoid bone which gets formed in the quadricep femoris, and from here the tendon now descends downwards as ligamentum patellae, attaching itself to the tibial tuberosity. Here you are seeing, so this is the ligamentum patellae. Here you are seeing the two bursae. One is subcutaneous infrapatellar, other is deep infrapatellar. Both are called infrapatellar because they lie below the patella. You must be wondering, why am I discussing so much? It is required, it is asked in your exams, and it is something you are expected to know. This is your subcutaneous infrapatellar bursa. This is your deep infrapatellar bursa. Therefore, let's revise. This is where you have the attachment of ligamentum patellae. Here you have the relation of subcutaneous infrapatellar bursa. Here you have the relation of deep infrapatellar bursa. Now, did you see that? Sometimes the infrapatellar bursa, the subcutaneous one, undergoes trauma due to repeated pressure, which is what we see in case of clergymen who spend a lot of their time on their knees. So the bursa gets inflamed, resulting in a condition called clergyman's knee. Okay, so that's why you have to know all these details. So question for you, what is clergyman's knee? Name the bursa involved. What is housemaid's knee? Name the bursa involved. Find out, give me the answer. Feel free to ask doubts. And of course, if you do not find the answer, you will find them in the notes section. Now I have a question for you. Mark the attachment of capsule of knee joint on the tibia. By now you should be able to mark it. However, some additional details are given here for you to go through. Remember, I have told you where is medial patellar retinaculum, where is lateral patellar retinaculum. The rest of the capsule is attached at the junction of articular and non-articular parts of condyles of tibia, and there is a little gap laterally for the exit of popliteus tendon. These are the 4 points you should remember when you are asked to mark the capsule of knee joint on tibia. For one last time, remember all answers present in the notes section. You can go and refer for answers there if you are not able to find them out on your own. Thank you, students, and I'll see you in Tibia Part 2. Bye.